Hi guys, Dana Palmer here. Today I want to talk to you a little bit about the diaphragm and just a quick conversation about the importance of diaphragmatic breathing and why that matters to you. So most people have heard of the diaphragm. A lot of people don't know what that is. It's a muscle that resides in our rib cage and it's important for breathing. It attaches to our breastbone, our ribs, and our low back. So even though a lot of people know it's important for breathing, what they don't know is it plays a really important role in posture and pain and sometimes pelvic floor issues as well. So what a lot of people do when they think that they're diaphragmatic breathing is they call it belly breathing. And what is meant by that is that when you take a big breath in, your belly is going to expand more than your chest. But what I see a lot of people doing is rather than really taking a big breath and expanding their abdomen, they're just using their abdominal muscles to sort of push in and out rather than using their lungs to fill up their rib cage. So a good way to check this for yourself, you know, a lot of times when we're observing something and we're paying attention to it, that changes the way that we do it. So I tell people to have a friend or a family member observe them or even video them when they're not looking to see where they're breathing. So if you're taking a look at yourself, when you're breathing, do you have more of a chest sort of coming in and out, or your muscles up in and around your neck really pulling and you can see them tensing up as you're breathing? Or do you see more of an expansion in your belly when you're breathing? A really good way to check this is to lay down on your back, because then everything is completely relaxed and you're not worried about holding yourself up and your posture while you assess it. So go ahead and lay down on your back. You're going to put one hand on your stomach and one hand up here on your chest. Okay, so just try and relax a little bit first and just see naturally as you breathe in and out what area is moving more and where you feel that expansion. So what you want to see when you take an inhale is you want to feel your abdomen expanding more than your chest. So I'm going to take a big breath in here. What you don't want to see is a chest expansion. So the way that that would look with a chest pattern of breathing, and you can see how my abdomen doesn't really move much at all. And when I'm trying to teach this to people, a lot of times they're really focused on making their belly move or belly breathing. And that's when you see a lot of just kind of pushing in and out rather than filling up their lungs. So you just want to think of taking a big breath in, almost as though you were bringing air into a balloon on the inside. You take a big breath in and feel expansion all through your belly and your lower rib cage. So give that a try, and I'll post some other videos about ways that you can help to facilitate that type of diaphragmatic breathing.